PRP application on your scalp came much later. Initially, it was used for various procedures like your orthopedic surgery, muscular injuries. Initially, when you're planning the treatment, it is not like once in a while आपने कर लिया. You need almost 5 or 6 sessions at a go, which are done like every month, one session you can plan.
Welcome back in the new episode. In the previous episode, we have discussed about the medication for hair fall. And as we had come to the conclusion that many people cannot continue the medication, it's because of the habit. Habit as in, if 10 people joins the gym, they take the membership, very less number will continue that because of the habit. Where like 20-30% people only will continue it. Remaining will go for a while, like a month or so, and then they might not continue it. Similar thing happens with the treatment people are taking in hair fall, because that treatment has to be continued for a longer time. It cannot be like you take out medication for like a month and you get results for like years. You have to continue it for like 6 months and then reduce it a little bit and continue it for the longer period. So this, because of this challenge of habit, people are not able to continue the medication. So in the last video we discussed there are alternatives of medication which are PRP and GFC. So in this video we are going to discuss what PRP is and how it works. PRP and GFC differences, Dr. Monish is going to elaborate that. Please Dr. Monish, kindly elaborate these PRP and GFC.
Sure. So before we go into the difference, first let us understand what PRP and GFC mean. So by PRP, or we call it as a platelet rich plasma. So this is not something very new. It's been like known for many years. In fact, you'll be surprised that PRP's application on your scalp came much later. Initially, it was used for various procedures like your orthopedic surgery, muscular injuries, जहाँ PRP as a stimulant to healing was being used. But scalp पे जब उसका effect देखा, so it with due course of time, it has been seen yet that your hair thinning and hair fall can reduce to a great extent. अब होता क्या है? So what we do is in PRP, so we know blood has certain components. There are blood cells, there is blood plasma. So when you have withdrawn blood, you need to centrifuge that and you need to separate the plasma from it. Now this plasma
of the blood. How do we centrifugate? Can you just explain that for the viewers?
Centrifugation is like there is a machine when you are going to rotate the blood that you have collected at a certain speed, let's say 3000, 4000 RPM for a period of 10 to 12 minutes. आपने rotate किया, automatically the plasma has been separated. Now this plasma has platelets which have certain growth factors. Right. Growth factors in a way, if I could name them like platelet derived growth factors, epidermal growth factors, insulin growth factors, numerous. ये growth factors को जब आप separate करके inject करते हो आपके scalp पे, especially in those thinned out areas, अब they do two things. First, they are going to act as a stimulant in terms of increasing the blood flow of those areas. The hair which were dormant, जो बढ़ नहीं रहे थे, they start getting that kind of nutrition, वो stimulation थे, they start growing, and even the hair fall to a considerable extent is reduced. Okay. With PRP. So you need initially when you're planning the treatment, it is not like once in a while आपने कर लिया. You need almost 5 or 6 sessions at a go, which are done like every month, one session you can plan. Right. Once you have done that, then later on, let's say even you do 2 or 3 sessions in a year, or we can say every quarter you do a session to keep it sustained. It really acts as a good way to controlling your hair fall and thinning because you're doing it periodically. You don't have to do it go and again and again. Even if you go and do it every month, there is no side effect with that. It's your own blood, it's your own plasma. But you don't need to do it later on. Even if you do it twice or thrice in a year, the effect will be sustained for a long time.
All right. So basically you are saying PRP, the plasma, acts like a fertilizer for the root?
Yeah, not exactly the plasma, the growth factors which are there. Because usme, we just not always have platelet rich plasma. There is something known as platelet poor plasma, जो हम use करेंगे but it is not going to be useful. Right. इसीलिए growth factor concentrate और GFC treatment came into existence. It became practicality now. People have started using GFC over PRP now because जब मैंने आपको बोला कि we need growth factors in them, but PRP में the concentration of growth factors is pretty less because जब आप उसको physically इतना treat कर रहे हो, पहले आप blood ले रहे हो, फिर उसको centrifuge कर रहे हो, then you are separating, so you end up losing a lot of growth factors. तो GFC में there is a different way. हाँ, there are certain specialized GFC tubes which are available जहाँ आप ब्लास्ट जब आपका ब्लड विड्रॉ करके आप उसमें डालेंगे, सो ऑटोमेटिकली द ग्रोथ फैक्टर्स आर रिलीज्ड इन द ट्यूब इटसेल्फ बिकॉज आपको उसको इमीडिएटली स्पिन नहीं करना. अब आपने मुझे पूछा था कि डिफरेंस क्या है. सो मेजर डिफरेंस इज व्हेन यू आर डूइंग पीआरपी, आपने ब्लड विड्रॉ किया, इमीडिएटली आपने सेंट्रीफ्यूज किया और उसको इंजेक्ट कर दिया. इन जीएफसी जब आप वो ब्लड कलेक्ट करोगे, सो लेट्स से फॉर अ पीरियड ऑफ 25-30 मिनट्स आपको ब्लड को उसमें ही रहने देना है बिकॉज द ग्रोथ फैक्टर्स
इमीडिएटली सेंट्रीफ्यूगेट नहीं करना.
हाँ, सो ग्रोथ फैक्टर्स आर गेटिंग रिलीज्ड, देन यू आर गोइंग टू सेंट्रीफ्यूग इट. सो आपको एक अच्छा खासा कॉन्सेंट्रेशन मिल जाता है ग्रोथ फैक्टर्स का टू ट्रीट. सो इफ आई टेल यू नाउ, especially in Look Studio now, when we have started using GFC on a very high basis, and a lot of patients are showing a considerable good amount of results compared to the conventional PRP treatment.
All right.
So same, the process remains the same as you do with PRP. You do 5 to 6 sessions initially, and then as a maintenance way, every year you go for 2 or 3 sessions. So your hair fall, hair thinning can be controlled to a large extent for a good amount of time.
So how we can conclude this? In PRP and GFC, in both the process, the blood is collected and then centrifuged. And after centrifugation, the plasma is separated in the tube. And in the GFC tube, the growth factor, concentrated growth factors are separated. Both will be extracted and then injected on the scalp on multiple points wherever you have more thinning. And that will act like a fertilizer in the root and help the root to get better, to get the strength, and that will lead to the thickness of hair. And this is how you can treat hair fall without the medication. And this is the most organic way to treat your hair fall without getting any sort of side effects. Or it's easier for an individual just to go for a therapy once in a month. That entire procedure will take about, getting into the clinic and coming out of the clinic will take about 40 to 45 minutes, not more than that. You can directly resume your work on the same day. You don't have to have any sort of downtime. And this should be repeated every month for first 5 to 6 sessions. And after getting 5 to 6 sessions, every quarter you can go for 1 PRP or 1 GFC to continue the output, to continue the effect of the treatment. Thank you very much for listening, and we will be back in another video. Stay tuned.